Let's talk about pain relief after your shoulder surgery. I like to use multiple modalities to help you control your pain after your surgery. This will include cold therapy, medications, and a nerve block. So let's start with the most obvious, which are medications. So the first medication that I like to prescribe is Tylenol. Tylenol acts with a different pathway than all the other medicines, and you can take this with the other medicines at the same time. Sometimes you might think, hey, I took Tylenol before and it never really helped me with my pain. But the main magic of Tylenol is that when you combine it with other medicines, it tends to amplify their effect. So when you take it with Advil or Oxycodone, it tends to make their pain relieving effect get a lot greater. So if you take the Tylenol with them, it'll help a lot. So you start off by taking the Tylenol as soon as you get home after your surgery, and you take it every 8 hours. The next medication you'll be taking is Advil. Advil is a great anti-inflammatory. It helps really well with pain. For some people, it actually works better than narcotic pain relief. Now, the downside of taking Advil is that there are a lot of interactions it has with other medicines that you may be taking. So if you're taking a blood thinner or a medicine that affects your platelets, like Plavix, then we may have to adjust the dose that you take, or we may limit the amount of Advil that you take after your surgery. Your doctor may have told you, don't take Advil as long as you're on Plavix or you're on Eliquis. And for long term, that is true. But for short term, maybe 5 to 7 days after your surgery, the risk might be low. And for every patient, it's different. So I will discuss that with you before your surgery, and we'll come up with a good plan with the Advil. But if you don't have any other medicines that would interact with Advil, we start you with the Advil as soon as you get home, and you take that every 8 hours, just like your Tylenol. The third medicine that you would take is Oxycodone. That is the most common narcotic that we use if you don't have an allergy to it. And the benefit of Oxycodone is it helps you a lot with your pain. The downside of Oxycodone is that there are some side effects. One of the biggest side effects is that it can cause constipation, which is a really bad complication to be dealing with on top of your pain from your shoulder. So we generally recommend taking Miralax, which is a stool softener, to help minimize the chances of you getting that complication. The other problem with Oxycodone is that if you take it for long periods of time, you can start to become acclimated to it, meaning you need more of it to have the same effect. So we generally like you to take it for just a few days after the surgery and then wean off of it rather quickly. So most patients are off of that medication by 3 to 5 days after the surgery. Typically, we have you take that as soon as you start feeling pain in your shoulder when the nerve block wears off. So when you start to feel some tingling in your arm, you start to feel some pain, you take 1 tablet. If that doesn't seem to relieve your pain after about 5 to 10 minutes, take another tablet. And again, if that doesn't seem to help your pain, you can take 3 tablets. And most of the time, that will help take your pain level down to something more tolerable. And then the next time you're due for a dose in 4 hours, you can take the 2 or 3 tablets that you needed to take prior. The first day, you may be taking more tablets, but the second day, you start weaning down lower and lower and lower, so you take less of the medicine so that you're off of the medicine by 3 to 5 days. And you can take that medicine in addition to the Tylenol and the Advil all at the same time without any interactions to be worried about. The last medication that you'll be taking is a steroid. It's called a Medrol dose pack. Steroids need to be given to you in a certain way. They start off with a high dose and they gradually taper down. And that's because your adrenal gland has to get used to the dose going down gradually. Don't stop with that medication in the middle of the dose. And the dose is given in a little foil package, and it'll have all the meds lined up for each day that you have to take the medicines. So the first day, you'll take 6 tablets all at once. The directions may say to split them up during the day, but I recommend taking them all at once in the morning. Start the morning after your surgery. The reason you take them all at once in the morning is because the steroid can sometimes cause insomnia and make it difficult for you to sleep at night. So if you take it in the morning, it's less likely that you'll have that side effect. Now you've got all these meds, they're all ready, waiting for you. What else can you do to help control your pain? Well, cold therapy is a really good modality to help control your pain. And you can use ice packs. And the good thing about ice packs is it's relatively cheap. The bad news about ice packs is that they melt very quickly. And usually your ice machine in your refrigerator can't keep up with the demand because you'll need some ice on your shoulder for at least 5 days after your shoulder surgery. Another method to help you with cold therapy that we can provide for you is a cold therapy unit. And that is where there is a unit that you put ice water in, and it has a pump that pumps the water around your shoulder to make it nice and cool. And the pad lays on your shoulder, and it can stay there for 4 hours at a time without any worry that it's going to burn your skin. So it helps when you're going to sleep at night. You can just turn the machine on, leave it on, and get a good night's sleep. If you're sitting there watching a movie or some TV, you can put the pad on and just sit there on the couch and enjoy the cold therapy. The machines we can provide you at our office for no additional cost on top of the manufacturer's cost, and we can help you get those. So that's what we highly recommend. Now, the third modality that can help you with your pain after your surgery is a nerve block. That is where the anesthesiologist will use an ultrasound and find the little nerves that go to your shoulder and give them some numbing medicine there so that your shoulder and your arm will be nice and numb when you wake up from your shoulder surgery. This helps tremendously with your pain because once it wears off, the pain level is much lower than what it would have been right after the surgery. Now, the nerve block typically lasts 12 to 24 hours. And then as soon as it wears off, you can start taking the stronger Oxycodone or narcotic pain medicine on top of the Advil and the Tylenol. So those are the main ways that we help control your pain. And I think if you're prepared with the medicines and the cold therapy unit, you will do really well after your shoulder surgery.